request message to me showing your full name, address, and profession. With these words, I introduce and welcome Dr. Savesh Goyal to the platform of International Forum for Promoting Homeopathy for his presentation. Dr. Savesh, your time starts now. One reminder, our session will end sharp at 9:30 p.m. Thank you. Over to Dr. Savesh. Welcome, Doctor.
Good evening to all of you, and my sincere thanks to International Forum for the platform for the homeopathy, and one of the special thanks to Dr. CJ Varghese to provide this opportunity to share my views with you all, with all respected seniors. I always consider myself as a student of homeopathy, not an expert of any divine science. So today I'm trying to just, I'm trying to correlate the things, uh, like law of similia. Similia is everywhere in the nature. So truth is eternal. So today, in a just brief, I am just trying to correlate the organon and the GNM view together, and with few clinical examples, not about medicine but how we can approach uh, with the understanding of organon and the GNM. Uh, so, sir, I can start now.
Yes,
Okay.
proceed.
Uh, just I'm sharing my screen. I hope you all can see.
Yes.
So my topic is similia between organon and GNM. Uh, Myself, Dr. Savesh Goyal. I am practicing classical homeopathy since years. First, my sincere gratitude to the stalwarts of the healing art, Dr. Henneman, our beloved Guru, Dr. Praful Vijaykar, and our divine Guru, Dr. Hammer. Next, I would like to pay my gratitude to my great well-wisher, my Guru, my teacher, Dr. B.S. Johari, and a special thanks to my classical homeopathy teacher, Professor Dr. Pankaj Agarwal, and my GNM teacher, to Dr. C.J. Varghese. Thank you. So, uh, how we can, why GNM with homeopathy? Uh, Homeopathy is just like a holistic concept, as Dr. Henneman told that mind, we cannot separate mind and body. Similarly, Dr. Hammer said nothing can happen in the body alone and nothing can happen in the mind alone, as he presented the view of psyche, brain, and body. Uh, there is simultaneous working over these three, like psyche, brain, and body. As I understood, psyche is like just like a transformer, and the transformer is sending the electricity to the brain, which is a meter, and the corresponding organ are just like switches. So what we are doing these days, we are just giving medicine in the switches. We are treating the part, but we are not bothered about the how transformer is giving light to the meter, and meter is supplying to the switches. So transformer is just like a psyche, and meter is our brain, and that corresponding brain leads to the corresponding organs. So, what is the necessity? What is the necessity to understand GNM and organon? As we can see, uh, j- basically, Dr. Hammer and much before Dr. Hammer, uh, Dr. Henneman was so visionary that if you can see this aphorism, you are able to see my screen.
Yes.
Okay. Is it visible?
Put it in slideshow mode, sir.
Okay. As in aphorism 17 footnote, as Dr. Hammer said that all disease starts from DHS, means an unexpected shock. He says that human fall sick due to the figurative reasons and animal fall sick due to the real reason. In the
Excuse me,
same,
Dr. Savesh, you may put it in a slideshow mode so that the image may be larger, bigger.
okay, actually, sir, I'm directly opening that organon.
Okay, okay.
I can enlarge the font. Is it visible now?
Yes, visible.
Okay.
Higher.
So, as in aphorism 17, footnote, much before Dr. Hammer, Dr. Harriman similarly quoted the view of GNM in the footnote of aphorism 17. He says that how our belief system are responsible for developing the disease process uh, uh, um, with a fundamental miasm, as he wrote that a warning dream, a superstitious fancy, or a solemn prediction that would occur a certain day. This is equally like a DHS. Somebody told that you are going to die in half an hour. This is like a belief system at certain hour has not unfrequently produced all the signs of commencing and increasing the disease, of approaching death, and death itself at an hour announced, which could not happen without the simultaneous production of the inward changes. These changes are occurring over the psyche, brain, and body simultaneously. In the similar fashion, Dr. Hammer also quoted that these all changes are simultaneously happening on the psyche, brain, and the body, and the corresponding organs. Hence, in such cases, all the morbid signs indicative of approaching the death, or we can say developing a disease as per the conflict, by and has been dissipated by an identical cause, and by the cunning deception or the persuasion to a belief in the contrary, health suddenly restored. What does it mean? Means if we can understand better our belief system, there can be changes in the cellular, there can be cellular changes according to the belief system. Like Japanese done an experiment. They put a saline water inside the body of a patient and told him that it is a cobra poison. And uh, after listening this, he got died then and there. This produces a DHS, and in the similar fashion it leads to the chemical production just similar, equally similar to the cobra's poison. And what in the last Dr. Henneman told that by means of this moral remedy, what is the moral remedy means? Moral remedy is just like as we can say in GNM therapy, or moral remedy, just making the patient understand disease is not a superficial thing. Primarily your vital force is affected by some conflict, and there is a reaction of the miasm. There is a reaction of the miasm as per the individual constitution. Some patient may react in the psoric form, some patient may react in the psychotic form, some patient may react in the syphilitic form. In the similar fashion, if you correlate it with GNM, there are three layers: ectodermal, endodermal, and mesodermal origin. uh, uh, if some constitution are sensitive to ectodermal conflicts, they will react according to it. I will show you in a slide. And some patients are sensitive for the endodermal conflicts, they will react accordingly that. And some patients are sensitive for the mesodermal conflicts. So uh, there is according to me, there is a formula of three, like sora, psychosis, syphilis, ectoderm, endoderm, mesoderm. So it's like three. Similar fashion, Dr. Hammer classified the disease in three layers. Like, and similarly, much before Dr. Hammer, uh, Henneman was so visionary that he understand the whole disease in the form of the fundamental cause, that is the miasm, sora, psychosis, and syphilis. This is the first biological law, like psych, brain, and organ. Simultaneously, our vital force and the miasm all work on these three levels according to the individual sensitivity. For example, an individual subjective perspective. As per GNM, its individual subjective perspective means people may experience the same objective life event like divorce, death, financial problem, hospitalization, etc., but their subjective interpretation of the situation may differ greatly. Like a divorce could be experienced as a separation conflict. If it would be experienced as a separation conflict, it will affect the breast gland as per the embryological layer. And if the person experience the divorce as an abandonment conflict, it will go through the kidney collecting tubule, which is governed by the brain stem, means the primate brain, the lower brain. If divorce is experienced as an anger conflict, it may affect the coronary artery. Means conflict can be same for the different people, but reaction comes how we perceive that conflict. And in organons, in the similar fashion, Dr. Henneman considered this as a fundamental cause. Means that if which predominant miasm, according to the predominant miasm, if someone is sorically predominant, someone is psychotically predominant, someone is syphilitically predominant, the conflict's reaction comes as per the miasm. Similarly, Dr. Hammer told that conflict reaction comes as per the perception of the patient. So conflict is just as aphorism 5 says, we have to see the exciting and the maintaining causes. Like in aphorism 6, sorry. आपका aphorism 7, causa occasionalis. We have to see the exciting and maintaining causes, but for the prescribing or finding the similia, we have to see the reaction of the individual as per the conflict. To understand this, Dr. Henneman beautifully wrote. So I told you the aphorism 17 footnote on which GNM is based. So, and there is one similarity. Dr. Henneman also took 30 years to establish this wonderful science, and Dr. Hammer also similarly took this much year. But we as a homeopath has an edge over any other science. If we as a classical homeopath understand the GNM, it would be more helpful for us to understand the organon in the light of modern medicine also. If we understand our philosophy in the light of modern medicine, we can easily talk with our friends, allopathic friends, in a more scientific way. Because in the time of Hahnemann, it is very difficult to establish the scientific explanation of everything. It seems to be like a philosophy. So everybody says, what is organon? Organon is nothing, because it is beyond our understanding. To understand this divine science, we have to work hard. As Hahnemann wrote that, I doubt after my death my contemporaries will understand this divine science or not. Still this is there. How many of us read organon daily? So aphorism 3 says, uh, if the physician clearly perceives what is to be cured in the disease, that is to say, in every individual case, the knowledge of disease indication means the pathogenesis of the disease. If we can understand the pathogenesis of disease, we can very well follow aphorism 209, which is a criteria to find the simillimum in a chronic case. What Dr. Henneman says, aphorism 209, he says, after this is done, the physician should endeavor in repeated conversations, mind it, repeated conversations with the patient to trace the picture of his disease as completely as possible. Similarly, Dr. Hammer says, like he has given that lady in whom I met in a train. That lady explained me 2-3 hours how she was treated of blood cancer with Dr. Hammer. It was a divine arrangement for me. Earlier, I don't believe that how can a person can treat 3 to 4 thousand cancer patients without medicine. In India, we are not able to treat cancer with medicine also, and he is treating without medicine. So it was a divine arrangement. I met that lady, and I have a thought like the day when I met the patient of Dr. Hammer, I will study this, and this has been arranged by the divine. So similarly, Dr. Hammer took lot of therapies of that lady by conversation, repeated conversation, and she got cured of it. But the knowledge of miasm has an edge in homeopathy to avoid the recurrences. So I hope in his last time, Dr. Hammer understood somewhere what is the edge of homeopathy. So he advised that lady to go to the India to avoid the recurrence of the cancer, and advised that Russian lady to Dr. Praful Vijaykar, go to him. So here, Dr. Henneman wrote that the physician should endeavor in the repeated conversations with the patient to trace the picture of his disease as completely as possible according to the direction given above. Means before 209 aphorism, Dr. Henneman wrote many aphorisms to how to treat acute, how to treat chronic, how to treat this and that, in order to be able to elucidate the most striking and peculiar characteristic symptom, in accordance which he selects the first antisoric or the predominant miasm. Here I add or the predominant miasm, it may be antisyphilitic, for the commencement of the treatment. Mind it, here he has written commencement, to start the treatment. It doesn't mean that with one remedy we may or may not cure. In the similar fashion, if we can understand what is the pathogenesis of our medicine, what is the pathogenesis of the patient, how he has developing the disease, it will be easier for us to understand the aphorism 209 and to find out the most similar remedy for the suffering humanity. I hope you are understanding.
Yes, doctor. Carry on.
uh, Now I would like to quote one more aphorism as Dr. First, I would like to quote Dr. Hammer's quote about the cancer. To sell chemotherapy, uh, uh, I would enlarge it. To sell chemotherapy as a therapy is most likely the biggest deceit in the history of medicine. Whoever masterminded this chemo torture deserves a monument in the hell. So, what is chemo? Chemo is just like a local treatment to that cancer. Chemo is just like a local, and uh, similarly, if we read aphorism 205 footnote, see how visionary Dr. Henneman is. He is Nostradamus. He wrote in the footnote of aphorism 205, I cannot therefore advise, for instance, the local extirpation of the so called cancer of the lip and the face, the product of highly developed sora. Means there has to be some inflammation. Priorly, there has to be some inflammation for the proliferation as well as for the destruction. Without the inflammation, no proliferation and no destruction will come. Means first sora has to be affected. Means primarily, if you understand the Haring's law, if some cancer patient is coming to you, if you do anamnesis of the case and search the past of that patient, you will find there is some suppression at the ectodermal level, then it goes to the mesodermal level, then it goes to the endodermal level and leads to the proliferation, and endodermal level produces the adenocarcinoma. So if we will understand the embryological concept of Dr. Hammer along with the organon, it will be a boon for the homeopathy to treat the incurable cases. As Dr. Henneman said somewhere, in chronic disease homeopathy is limitless, the product of highly developed sora, not infrequently conjunction with the syphilis. Means here we have to understand the miasm in homeopathy and the embryological layer. Similarly, embryological layer, understanding of embryological layer is very similar to the miasm theory of Dr. Henneman. By means of the arsenical remedy, we can say here chemotherapy, not only because it is excessively painful, but often fails, but more for this reason, because if this dynamic remedy should indeed success, dynamic remedy, here comes the homeopathy. And if we talk in terms of GNM, that may be called as GNM therapy, freeing the affected part of the body from the malignant ulcer locally. The basic malady is thereby not diminished in the slightest. The preserving vital force is therefore necessitated to transfer the field of operation of great intermalady to some more important part. Here, Dr. Henneman is trying to uh, tell about the importance of the embryology. If we are suppressing some ectodermal disease, it may go to the mesoderm, it may go to the endoderm, according to the miasmatic sensitivity of the individual vital force and its reaction according to the perceived conflict. The consequence is like blindness, deafness, like if we remove the brain tumor. If we remove the brain tumor, tumor has gone, but the patient develop blindness, insanity, suffocative asthma, dropsy means we are, if we can understand the Herring's law as per the embryological layer, like Herring's law, like miasm, we can understand it better if we read Organon and GNM hand in hand. It will help us to understand the fundamental, understanding of the fundamental miasm in the light of modern science also. But this ambiguous local liberation of the part, like local liberation by chemotherapy, by operation, uh, in those cases where the ulcer has not yet attained any great size, when the vital force is very still very energetic, but it is just in such a state of things that the complete internal cure of the whole original disease is also still practicable. That so when the cancer of the face or the breast is removed by the knife alone, when an encysted tumor are enucleated, something worse ensues. At any rate, death is hastened. Similarly, Dr. Hammer wrote that saline chemotherapy, they have been sent to the monuments of the hell. So there are very much similarities between the two divine souls, work of the two divine souls. As Dr. Hammer told the about the conflicts and the relation of the organ. If we see this slide,
Doctor, you didn't change the slide, doctor.
uh, okay, now it is it visible, sir?
Now it's visible, sir. Oh, yeah.
Is it fine, sir?
Yeah. Yeah.
Okay. So, uh, if we can see the nest worry feeling, disfigured touch, feeling soiled, self devaluation, feeling attacked, these are all types of the conflict, or in the terms of organon, we can say exciting or the maintaining cause. These are the causes which excites the miasm. Miasm is already there, but we need some stimulation, we need some external stimulus to excite our dynamicity, to to excite our vital force, to take as a defense in the form of sora, psychosis, syphilis, or in modern terms we can say it may produce ectodermal disease, it may produce endodermal disease, it may produce mesodermal disease. So, your subjective assessment depends upon your past experience, values, and beliefs, social conditioning, culture, fear, and vulnerabilities. If we see aphorism 5, similarly, Dr. Henneman wrote in the aphorism 5 that to find out the fundamental cause, in these investigations, the ascertainable physical constitution of the patient, his moral and intellectual character, his occupation, mode of living and habits, his social and domestic relations, his age, sexual function, etc. Dr. Henneman was so intelligent in most of the aphorism, he wrote etc. So that etc. work was done by Dr. Hammer. That etc. work. So we can also do this etc. work. We can also do this all etc. work. So this subjective assessment depends upon our lifestyle, this and that. These all are necessary to understand the conflicts and related organ disease. But main point here, with the help of homeopathic philosophy, we can understand above conflicts, above organ disease, the main how conflicts react. Reaction of the conflict depends upon the miasm. So to understand the miasm and GNM together, it will be like it will be like a very important key to understand the human psychology and human body, how we are behaving. Even with the help of Dr. Hammer work, if you all know the constellations, the schizophrenic constellations. If we read schizophrenic constellation, I will show you some example. If we read schizophrenic constellation, we can understand that the materia medica, the different materia medicas of different medicines like lachesis, why lachesis is loquacious, we can understand with the help of constellation. Why platina is so egoistic, we can understand with the help of constellation. Why somebody will go into the some delusions and deliriums, we can understand with the help of constellation. And this gives a lot of confidence to patient. When I discuss this with the help of organon and GM with my patient, patient says 50%, doctor, 50% I cured here only. So uh, here one more example I would like to quote from the chronic disease, where Dr. Henneman similarly mentioned the effect of our emotion and the relation of the breast cancer. Uh, are you able to see it?
Yes.
Hmm. In the chronic disease, the true nature of the chronic disease, theory of chronic disease, very beautifully explained by Dr. Henneman, that a sora, asora, the slumbering within, means the fire which is slumbering within, means if you can understand with the GNM, it's like somewhere ectoderm has affected first, or some inflammation has affected first, which still allows the favorite of a prince to live with the appearance of almost blooming health, unfolds quickly into the chronic ailment of the body, or distract his mental organs into the insanity. Mental organs into the insanity, what does it mean? I understand it as an embryology, like our cerebral cortex, like our cerebral medulla, our brain stem, these are the mental organs. They are affected with the conflict, and they react according to the miasm of the individual. Insanity is just like proliferation of the cancer cell. Cancer cell is just like insane. They kept on developing, because it's just like an insanity. When by the change of the fortune, he is hurled from his brilliant pinnacle and is exposed to the contempt and the poverty. Here comes the example, like just Dr. Hammer told that nest worry conflict leads to the breast cancer and death fright conflict leads to the lung cancer. In the similar fashion, much before Dr. Hammer, similarly Dr. Henneman also reflected the idea that sudden death of the son caused the tender mother already in the ill health and incurable suppuration of the lungs. That mother has, just like she has the survival conflict without her son, so lungs are affected as she consider her son death like her own death. Without my son, how I can live on this earth? This leads to the involvement of the brain stem, and brain stem controls the lungs, alveoli. So after the death of his child, the lungs goes into the healing phase, and the endodermal organ in the conflict phase, they proliferate, they go into the psychotic miasm. And healing any psychotic cancer heals by the miasm syphilis, means by the destruction, by the a multiplication of the bacteria by the caseation. So miasm are always necessary to understand in the form of health and in the form of the disease. Body also fights in the form of, if you leave that cancer, body will ultimately go into the syphilis after the proliferation. Or Dr. Henneman told that sudden death of son caused the tender mother already ill in ill health, जो पहले से she is already ill, an incurable suppuration of the lungs or a cancer of the breast, and a young affectionate maiden already hysterical is thrown into the melancholy by the disappointment in love. So Dr. Henneman also talking to many years back about this modern science concept, which has been elaborated in a beautiful way in the light of modern science by Dr. Hammer. So these two divine souls work very hard for the suffering humanity, but we have to take this work ahead by understanding, by our untiring efforts. We can help the suffering humanity if we can correlate these two beautiful signs together. So uh, like moral remedy, which Dr. Henneman said in the aphorism 17 footnote. Moral remedy, what does it moral remedy means? If I have some conflict, like I would like to give some example. Today morning, one lady came to me. She has a galactoria, and her prolactin was 486. 486 since last January to 2021. She is having that milk secretion, though she is not pregnant. And she came to me. I asked about the which side of the breast is lactating more. She told me that my left side of the breast is more lactating, and she was right-handed patient. If we can understand the brain dominance, our right brain controls the left body, and our left brain controls the right body. So I inquired about the exciting or the maintaining cause. Causes are there to excite the miasm. Cause cannot cause the disease. Cause is necessary to excite the miasm. That aphorism I will also would like to tell after a few minutes. So that lady told me that in the January end she lost her father. In the January end she lost her father, and after about 15 to 20 days she starting she started with heaviness of the breast and secretion of the milk on pressing the breast. But as we understand, as per Dr. Vijaykar's teaching or brain dominance teaching, if our left side is affected, it is related to mother and child conflict. But she lost her father, so how come it to the left side? So this is the understanding of the Dr. Hammer work helped me to understand this conflict. I would like to share about that prolactinemia. I think, is it visible?
Now your slide is not moving.
Uh, Actually, sir, I am opening the website.
Okay.
This is visible.
Now we are in the conflict resolution slide still.
Okay, is it visible now?
No change happened.
Now?
No.
No.
Yes.
I think now is it visible?
Yes.
Okay. So that lady came to me in the morning, today morning itself. She is having the prolactin increase. Dr. Praful Vijayakar beautifully explained us everything. matlab, Beautifully explained us everything. He always say that first you have to see the patient coming to you, he is in the physiological state or he is in the pathological state. As far I can understand her case, She's not having any pituitary tumor. It's just in physiological alteration. Like if we're treating the physiology, if we read the aphorism 73, I think it's for the acute disease. Physiology, if we're treating the physiology, we can take the ailments from, because physiology is altered by the exciting causes. Like the day before, yesterday I got a case. That child got developed fever after losing the some rank in his class. So that is the immediate cause, because we are treating the physiology. If we're in which state patient is coming to us, this is more important to understand. If we will treat on the basis of pathology a physiological case, it will not give us result. So that it is a matter of 4 or 5 months after the death of his father, she developed that prolactin secretion. If we go through with the slides of the Dr. Hammer work, that pituitary gland developed from the primitive brain, that is called brainstem, means this is endodermal in origin. we, if we can understand the embryological layer, which Dr. Praful Vijakar very beautifully explained in his theory of suppression. Everyone must read that theory of suppression to understand the embryology in the way of classical homeopathy, and to get it relate with that Dr. Hammer's work. So it is endodermal. So, so what Dr. Hammer wrote here, what is the biological conflict, which is the exciting cause? The biological conflict linked to the prolactin producing cells means there is endocrinal production of that hormone, that prolactin hormone excessively. What he wrote, feeding conflict, as in not being able to nourish the child or the family. Let's say because of the financial difficulties, or say death of that person who is giving financial support, who is giving nutrition. So her father is giving financial support, her father is giving emotional support to her family, but as far I can understand, father should come on the right side. But her right breast is secreting very less milk, and left breast gland is secreting much more milk. So what she told to me, she told me that my father has gone, but I should, who will take care of my brother, who will take care of my mother? That's why she has developed the left sided secretion of the breast milk. So with the help of this Dr. Hammer work, we can very well understand why he's going towards the left, why he's going towards the right, and beautifully we can interpret our rubrics. So I would like to show you rubrics. I took screen share, new share. Is it visible
Still on the website.
now?
Yes.
Is it visible? Repertory part is visible.
Yes.
Okay. So there is a rubric, chest milk pregnancy in women when not related to pregnancy. I took this, and I took ailments from death of loved ones, especially parents. So that lady was very much consensuous. She wanted to do love marriage, but she refused to do, because she always said that parents are my priorities. How I can go against my parents? They has right on me because they have done so much for me, so I cannot go against my parents. I will do only arranged marriage. She never affronted her in-laws. She never had quarrel with in-laws, though they are torturing her. So if we, but she is very much like woman liberation. She cannot tolerate injustice outside the home, but she always take care. They are elders. I should not do this with the elders. She is very consensuous. So I prescribe her today Ignatia, because Ignatia is like very consensuous. That Ignatia personality has conflict between the feelings and the reality. Her feeling was to do love marriage, but reality was that she is very much consensuous. She cannot go against her parents. So in this way, we can we can more precisely work over the aphorism 209. Like Dr. Henneman told that after several interviews, you have to find out the most peculiar thing, most important thing to find the most similar remedy. Most similar remedy. So these are, we can fasten the conflict resolution with the help of homeopathic remedy if we are treating a pathological case. If it is very much physiological, like we can use moral remedy like GNM therapy, or this as such, as Dr. Henneman told, cunning deceptions, that kuch nahi, that like you don't worry, you are fine, nothing is there. So patient can develop confidence. I think 10 more minutes are left, so I'm about to finish it. Uh, I would like to quote one more aphorism. As Dr. Henneman said in the aphorism 206 footnote, here I would like to tell the importance of the miasm, how only alone our conflicts cannot produce the disease. It's important to understand the miasm along with the conflict. So in the aphorism 206, is it visible?
Yes.
Before commencing the treatment of a chronic disease, it is necessary to make the most careful investigations, like understanding the conflict, which embryological layer is involved, how that embryological layer is affecting that particular organ. We can understand this in the light of GNM aphorism 206. As to whether the patient has a venereal infection, means venereal means either psychotic or the syphilitic, either that uh, person is going into the proliferation, means endodermal conflicts, or he is going into the ulceration, means ectodermal conflicts. In the conflict phase, ectodermal organ goes into the ulceration and endodermal organ goes into the proliferation. So we can very beautifully understand the proliferation process and the ulceration process and the inflammation process, like Dr. Henneman very well mentioned. The ectodermal, endodermal, and that mesodermal reaction in the aphorism 74. He very well beautifully wrote that, if that aphorism 74, if we can read, aphorism 74 says, uh, in order to maintain the life against the inimical and destructive attacks. Inimical and destructive attacks are like conflicts, inimical, like a reaction of the miasm. It must produce a revolution in the organism, either deprive some part of its irritability, sensibility means ectodermal, like neuroectoderm, or exalt this to an excessive degree, cause dilatation, contraction, relaxation, induration means psychosis, even total destruction of the certain parts, and develop the faulty organic alteration here and there in the interior and exterior. Here, Dr. Henneman very beautifully explained all the three layers in the form of the miasm. Sora, syphilis, psychosis, यानी कि ulceration, proliferation, destruction, very beautifully explained in this aphorism. So in aphorism 206, footnote, when we are treating the chronic disease, we are treating the miasm. Sometimes we are treating the chronic disease and we got the history that there is a death of his father 10 years back and he developed that cancer, and we took ailments from the death of father, and like cancer of the breast, but there is no result. Why there is no result? Because we are not treating the miasm. As he said in the aphorism 206, in the investigation of this nature, we must not allow ourselves to be deceived by the assertion of the patient or their friends, who frequently assign the cause of chronic disease, like cause of cancer, cause of autoimmune disorder, cause of rheumatoid arthritis, even to the severest and most inveterate disease, like patient told that, doctor, after the attack of anger I got increased my pain. If you treat an autoimmune rheumatoid arthritis, by taking the rubric ailment from anger, joint pain, if it will not cure. It will not cure. Either a cough caught cold caught through the wetting, drinking cold water after being heated many years ago, a former fright, a sprain, and a vexation, sometimes even bewitchment, means black magic, etc. Dr. Henman always used to write etc. You can add something. These causes are much too insignificant. These are too insignificant to develop a chronic disease. So, if we will not understand the miasm, we cannot effect a cure in these threatening cases. Chronic disease in the health of the body to keep it for years. If a 10 years cancer, 5-year cancer, or 10-year rheumatoid arthritis, last 15 years ankylosing spondylitis, diabetes, we are not getting results because we are not treating the miasm. Each and every time we are taking the emotions like ailments from anger, we cannot, Dr. Vijayakar very well said that we cannot, you cannot use same yardstick each and every time. There has to be different angle of prescribing to every case according to the miasm. If you want to treat syphilis, you have to think that way. If you are treating the psychosis, you have to think that way. We can refer the aphorism from 40 to 48, I think, complex miasm aphorisms, to keep it for years, to aggravate it to aggravate it year by year, as is the case with all chronic disease from the developed sora. So if we will understand the embryology, it is very much easier for us the pathogenesis of the disease, which drug act on the ectodermal origin, which drug act on the brain stem. I would like to refer a book to understand the embryological layer. The great work done by.
We'll just proceed to wind up this session.
Okay, okay, sir.
Five
Okay,
more
sir.
minutes are there. Uh,
Okay,
Usually we conduct an interaction or question answer session, but
okay,
we are having limited time, so you may please wind
okay,
up.
okay, 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 okay. So this is my little effort to make all of us little bit understand the little bit understand the relation of the GNM with our divine work, that is organon. So in the last, I would say, man is the made by his belief. As he believes, so he is. Thank you, thank you.
Thank you, Dr. Savesh. It was an awesome presentation, and the participants was a record, or the number was a record. There were 267 participants. And for your information, Dr. Hanneman and Dr. Hammer died on 2nd of July. And
Yes,
for
yes.
another information, out of 6,500 patients treated by Dr. Hammer, 6,000 patients were alive for more than 5 years without any medication, including homeopathy medicines. So the future of medication or future of medicine, the medical science, as we have understood it is nothing but the classical homeopathic approach. That is the miasm based right homeopathy and the German new medicine that together can lead to the world. And thank you, Savesh. It was really a wonderful presentation. You made it wonderful with a very short notice. I approached you only 2 days back,
Thank you,
and
sir. Thank
you
you.
promised and you did it very well. And always I repeat what Dr. Sarvesh told. GNM is complementary to homeopathy, and homeopathy is complementary to GNM.
Very
And
right.
person, there was a lot of confusion, misunderstanding about the GNM, and I hope gradually people will come to understand and learn more about the German new medicine also, along with the homeopathy. And there were 4 raised hands I'm seeing, and the Oppo F19 PRO. I don't know if she raised the hands first. Can you give her technical people, please unmute her. So these are the slides you are seeing of the tomorrow's paid webinars by Dr. Ismail Said and also of Dr. Abdul Latif. So I'm going to Dr. Sujit Chauhan, who raised his hand second time. Dr. Sujit, please unmute yourself.
We have only 2-3 more minutes. So kindly make the questions very brief. Technical end, please unmute Dr. Chauhan. Sujit Chauhan, you can unmute from your side. Or next we go to Dr. Amir Malik from Pakistan, Lahore. Unmute yourself, Dr. Amir.
Thank you. Thank you very much. First of all, greetings and namaste, salam to all our IFPH members, and my special million and billion thanks to Honorable Sir Dr. CJ Varghese, and today our guest Dr. Savesh. A special thanks to all of them. And the reason of special thanks to Honorable Sir Dr. CJ Varghese is that my missus is practically the patient, and she was cured by the Honorable Sir CJ Varghese treatment, GNM therapy. 2 months ago, my missus suffered from a very critically ill. She is suffering from the back pain,
Please
and we
make it
all,
very short, Dr. Amir.
yeah. I just want to first of all appreciate and thanks, a billion thanks to Honorable Sir CJ Varghese and GNM therapy. And our sir today, Suresh, give the details how the miasms destroy and take over our body. The miasms hijack our body. So it's a very wonderful presentation. When the patient is blocked, conscious, unconscious, and superconscious, when the patient is blocked in this id of the brain, this is the only GNM therapy which I got it, that the patient will comes out, either it's grief, it's trauma, it's phobia, it's historical issues. But if the patient was stuck at that stage, believe me, this GNM therapy, it's really very appreciated. It's very effective, because my family and we are the practically victimized of this, and we get cured by the treatment of Honorable Dr. CJ Varghese, and we are the alive proof and cure of GNM therapy.
Thank you, Dr. Amir. Shall I interfere? Because the time I have to hand over this platform to the next session, and I will give a chance to Dr. Lokamani Gupta. Please kindly make it very short.
Sure. So I just wrap it, and I just want to say a lot of thanks and love to our all IFPH doctors, members, creators, lovers, and please, a special thanks to Honorable Dr. CJ Varghese and Dr. Savesh. Thank you.
Thank you, sir. Thank you.
Dr. Lokamani, please.
Thank you, sir. Thank you, sir, for giving me an opportunity. I pay my sincere regards to
Go
you.
for it, very fast. I do not know whether there are
Sir, I think what I understood from the very good presentation of Dr. Savesh ji, that our old ethics should be followed by everyone. As we know that sensations creates the functions, and functions creates the organs. So what we think, it comes in the picture with various functions and organs. Second thing, sir, organs may be creative or destructive. In short, as I have to speak. Second, sir, that's why only our elders regularly says that religious books must be read by a pregnant lady, so that good thoughts and good generation of all the embryos may develop, all the layers may develop healthy, and that's why Dr. Sarvesh ji very well related it with astrology also, as I think. Thank you and congratulations to Dr. Sarvesh ji. Thank you.
Thank you, sir. Thank you, sir.
Plus, so I hope Dr. T.M. Sridhara Purup, Dr. Sujit Chauhan, Dr. Bhavish Khera, and Dr. V. Patma, I don't know, I cannot read. So all this still kindly pardon or bear with us, because we are supposed to hand over this platform to the next session. Is it not so, Dr. Manoj?
Yes, sir. Yes, sir. It's already.
So otherwise it will go on. I'm very sorry for that. And again, once more, I am extending my very cordial sense of gratitude to Dr. Savesh, who came to our platform and made it a wonderful event. And thank you once again. And all the participants who are very much cooperating, and we thank
267. That was a good number. And I am sure that this will create an interest in the learning of German new medicine for the newcomers. I wish all of you a good learning and for the humanity, not for any other purpose. And we are learning homeopathy, we are learning GNM for helping the humanity. And in these very difficult situations, we can very assuredly or very confidently say that the classical method of homeopathy and the German new medicine can together help the world to a very large extent. Thank you. Thank you, everyone.
Thank you.